So my name is Dr. Robert Yee. I work in Sunnyvale. I actually took over my dental practice in 2021. It's a very family-oriented practice. We have been in business since the 60s probably. I bought it from my dentist, and I've been a patient at this practice since I was 5 years old. So been there for 32 years. I had just looked at iTero literally like maybe 2 weeks prior, and they brought in the stuff that I was interested in, but without having to be like this whole big like wheeling setup thing, like this big monitor. I'll be honest, the main thing was the support that I could receive, that if something wasn't right, I could come to them. If something was off, I could come to them, which they could get in contact with iTero right away. I didn't have to worry about going through multiple different people. I could go to one source and it would be taken care of. Right when they brought it in and then I decided to sign up and then everything was delivered, I was like, oh, this is great, let's use it. No one else knows how to use it, so I'm gonna have to just do it. And I'll be honest, this is the way I kind of used to teach dentistry too, to my students. I'm like, hey, you guys just gotta jump in and do it. I think the hardest thing for me was just getting and figuring out where it all was gonna go. How could I hook up the system? Where do I sit in relation to where the scanner is? Is it gonna take longer than if I just took impressions, opposing impressions and then bite registrations and everything. The transition actually was pretty seamless, especially with the assistant I was using. She didn't have any experience with scanning, and it worked really well right away. I'm taking a more active role in seeing what's going on behind the scenes, and if there's something that I need or something, like CDA has been really responsive to me. I feel like there's a little bit more of an intimate, I can see online like, oh, it's being modeled. I can track the progress of my crown right away. I think the advantage of the partnership is that, yes, I could have purchased a scanner from iTero or whichever company, but by having it with CDA, they have something invested in me. They invest in me, I invest in them, and it's like mutually beneficial partnership. If you're in a position right now to decide if you want to do scanning technology or you want to partner with CDA and everything, I would say do it. CDA's been around and they'll take care of you. If you want that relationship with your lab, this is the way to go. There's a trial for it. There's really no cost to us. Give it a few cases, try it out. But you'll be amazed at how much benefit it brings to your practice, how much easier it is for your staff. My staff love it. They don't have to worry about any lab work, really. The patients like it. They don't have to deal with getting stuff in their mouth all the time. I would say go for it. Like for me, I'm one that does research for years. I've been looking at these scanners for a really long time, and I had my doubts. The best thing is just talk to everyone. Talk to people at CDA, talk to some of us that have done it. I would say just take a leap of faith and go. And I did, and it's worked out really well for me.